Marea, how would you describe CoolSculpting? You know, what is CoolSculpting?
I think the easiest thing for me to say when I'm in with my patients is that it's to get rid of spot fat, areas of fat that are diet or exercise resistant. And that immediately dispels anybody thinking that, oh, could I have a whole part of my body be made to look slimmer?
Yeah.
No, I say it's spot fat reduction. And I think that most people can understand that. Do you think?
I do. It's ironically like a big question sometimes, I think, because what is CoolSculpting? It's a scientific method of permanently removing unwanted pockets of fat, isn't it? I think that's my best synopsis of what it is.
Well, that's better than how I say it, actually.
But then it kind of leads into how does CoolSculpting work?
Okay.
I love this fact, and I say it all the time and nobody believes me really, but that we develop all of our subcutaneous adipose fat in our juvenile years. Now, there's loads of variables to that, isn't there? You know, genetic predisposition. So as we now know, some people are born genetically and they will carry more adipose fat than other people. There's not a lot they can do about that, and they have to be extra conscientious of what they eat and discipline with exercise and so on. But fundamentally, from the age of, you know, being born till about 18, when we reach our developmental cycle and our bodies start going the other way, we develop all of our fat cells. And then as adults, you don't produce more fat cells, nor does your body kill fat cells. I'm talking about an average healthy individual.
Yeah.
But what happens is the fat that you then carry can expand or shrink with diet and exercise.
And not many people realise that, do they?
No.
They think it's about putting on more numbers of fat cells.
Yes. I think knowing that is kind of relevant to knowing how CoolSculpting works.
Yeah.
Because if you're trying to lose a stubborn pocket of fat and you're doing everything, you get quite despondent at a point, and you just think, I'm doing everything and it's not shifting.
Yes.
And it's because you can't kill those fat cells.
So you might have like a larger amount or numbers of fat cells here, or let's say there, but maybe your arms aren't that way.
Yeah.
It could be that, could it?
Let's do an example if we're talking about jawline definition, you know? It's a real thing at the moment, especially with young girls where the profile image is really coveted and they want this beautiful profile. And jawline is very relevant to profile, isn't it?
As we know when we're injecting dermal fillers.
Exactly.
Yeah.
And so we see a lot of patients, don't we, with this pocket of fat, and they're skinny, they're really thin young girls, but they have a pocket of fat and they can't do anything about it.
And that's genetic, isn't it?
It's
I bet
genetic.
their mother or their father probably has that continuation.
Exactly.
Yeah.
And sometimes, more often than not, CoolSculpting has a really beautiful effect on just reducing that unwanted pocket of fat. I've got a list of questions really, but one of my other favorite questions is, who is CoolSculpting most suitable for? It's a really common question we get. What would be your take on who's most suitable for CoolSculpting?
I'd go back to what we've just chatted about really, which is anybody that's got some unwanted fat. And I like that you said that, because it's all very well, but you, the person, the patient, has to not want it.
Yeah.
And whilst you could get to be very satisfied with your contour here, you may not be satisfied with fat pads above your bra.
Yeah.
That's a big thing, isn't it? As we get older as well. So I would say anybody could be considered, but the nice thing about our clinic at Qutis is that we're nurse-led, and advanced nurse practitioners such as ourselves, we're trained and qualified to take a good consultation and are able to sift out, filter out people who would not be suitable. Could you say someone with too high an expectation would be unsuitable, or how would you manage that one?
I mean, yes and no. I think expectation setting's really relevant with any of our treatments, isn't it? Overweight, somebody who would fall into an obese category, so a BMI, a body mass index of 30 plus, which we know is based on your height and your weight and your age. Now again, that's loose. BMI has some controversy against it, but we're talking about somebody's overall body fat percentage. CoolSculpting could be very expensive for them.
Oh,
And so they might find that they're better off, and my advice as a nurse would be to go down a diet and lifestyle, or talk to a surgeon about liposuction, because we're not anti-surgery, are we? And sometimes if someone's really struggling, that may be a really good option for them. But diet and lifestyle is always a conversation we have with our patients, regardless of how they present, isn't it? If we can support them in any way. Those are typically not very suitable patients.
Because they've got too much fat.
They've got too much fat. And CoolSculpting, they would need, it's killing 27% of unwanted fat in a target area. So if you think about the target area, so let's take a flank, a love handle, muffin top, whatever you want to call it, and you pinch and grab those muffin tops. You think about a 27%, so let's say a quarter of a reduction in that pocket.
Yeah.
If you have a really significant overweight love handle, and you want to reduce it, and you're only going to reduce it by a quarter each treatment, you in your mind as a potential patient can maybe kind of think, okay, well, I'm going to need 4 or 5 times treatment in that area if you've got a significant amount. Whereas if you're relatively fit, lean person, but you just have those unwanted love handles, CoolSculpting, 1 treatment, maybe 2, will have an enormous impact right away.
Do you ever look at people's silhouettes then?
Yes, with CoolSculpting, so this is really, really important, because I get this question a lot, how often do I have to come and have it? And I love answering this because it's not a course of treatment. You have maybe 1, maybe 2 treatment sessions, sometimes 3 treatment sessions, depending on your treatment goals and our plan. But the results are permanent. So you don't need to come and keep having CoolSculpting treatment. Each time we treat you at Qutis, we're killing 27% of that unwanted fat.
Where does it go?
It just dies. So we have 5 different types of white blood cells. And macrophages are, I like to think about them as like our little SAS of white blood cells, but the macrophages are they're like Pac-Man, and they come in. So we freeze the unwanted fat, and we make those fat cells unstable. Fat doesn't like the cold, so we bring it to a temperature that it's unstable. Then your immune system, your white blood cells, in particular your macrophages, come into the fat and they continue and complete the destruction of those fat cells. But it's so
I guess
gradual.
they lose their content and then...
They become unstable and apoptosis happens, so cellular death happens.
What?
Apoptosis.
Right.
I know, I like a scientific word. And then your body just removes them really gradually, really slowly through your lymphatic system. Has to date, no clinical studies have indicated it has any negative impact on liver, hepatic, renal system, on your kidneys. It's such a slow process of removal.
I guess because when I had it myself, I was thinking, will I notice that I'm going to the toilet more often? And I'm pretty much sort of like remember, and nerdy like that, but I didn't really notice. But I think I might have drunk water. But do you ask people to drink water after?
So, short answer is no. You don't have to do anything to see results aside from maintaining your existing weight, and your existing lifestyle. We don't want our patients to go away and suddenly think, oh, I've had CoolSculpting, I can eat and drink whatever I want and I don't have to exercise anymore. I just want them to maintain. However, if they are embarking, which a lot of our patients are, aren't they? They're embarking on a healthy lifestyle journey. Not extreme dieting, I don't condone that, but we condone a varied diet of 30 different vegetables, grains, fruits, colors during a day, and obviously staying hydrated and all of those sorts of things. They will help see results because you're putting your body in a good metabolic state. So your results will be even more improved. But you don't have to do that. You don't have to drink 3 liters of water a day to see results. But obviously I am an advocate of hydration.
I mean, I totally get that. One of the things that I thought about after some of my CoolSculpting treatments is a little bit like, you've paid for this treatment now, girl. Make sure that you look after it. Don't do anything. And you know what? That gave me added incentive to live or to eat more healthily. Because I think we tell ourselves so many things, or we can just have one more piece, or one more this, or hey, it's the holidays, or hey, it's not the holidays, or hey, I feel happy, or hey, I don't feel happy. And we just use all of those things. But once you've had CoolSculpting, have you heard this from other patients? That they want to look after what they paid for?
It's my encouragement to patients as well. So, you know, when someone says, oh, well, I'm starting this healthy lifestyle journey, I've got this a bit of stubborn fat, unwanted fat, we like to call it, that I want to shift. Am I better to start my healthy lifestyle and come and see you in 3 months? Or should I start with CoolSculpting and then carry on?
I know what you're going to say.
Yeah, and my answer is start with CoolSculpting. Start with it all, because you're then working against less fat cells. So you see results so much quicker. And you can, of course, put on weight. After you've had CoolSculpting, say we're talking tummy, and you put on a bit of weight, you will still put on a bit of weight in the tummy, but you'll notice it's so much less than if you hadn't had CoolSculpting. And more importantly, when you then finish your summer holiday or your Christmas holiday, if you want to shift that slight extra pinch that you've given yourself because you've indulged, it takes half the time because you have less fat cells. So anyone who's trying to maintain momentum to exercise and eat healthy, it's hard, like I said, when you're not seeing results. When you've had a bit of CoolSculpting, you see the results so quickly that it's encouraging, and you think, yes, this is reward. You omit the short-term reward, which would be the cake or the film night, for the long-term reward, which is a nice healthy body and lifestyle, which gives you a healthy mind, because we feel good on the inside if we look good on the outside. You know, it's all of that psychology.
It's kind of addictive. Could it be addictive, do you think?
Yeah, well, that's a caveat. When I'm consulting patients, I do say it's addictive. And you can't,
in a good way.
In a good way. You can't keep having CoolSculpting because it only works on fat.
Yeah, you'd sort of turn people down anyway, wouldn't you?
I would. I mean, as we sort of have you're beautiful, we don't need to. You know. But you have one area treated. So upper bra, really common for women, isn't it? That stubborn fat. You have that area treated, you see the results, and then you start pinching yourself. You think, oh, if I can pinch it, I can CoolSculpt it. Where else can I have treatment? And that's where I say it's addictive.
But you know, for me, as someone who had CoolSculpting, you know, I started here and then we went all round here. And I think the only place I didn't have done was my arms. I even had hair done, didn't I? But for me, it was about looking better in clothes, really. And you know, we talked about silhouette. Because there's nothing worse than seeing a bulge in a t-shirt or something. But to just feel that little bit smoother.
To feel svelte.
That puts a really good feeling inside a person. I
had a patient and she wears a sari. For occasions. And in her sari, and again a genetic predisposition, she really struggled with upper back fat. I can imagine. And the sari can be quite unforgiving, can't it? You know, because they're wrapped tight. And she just wanted to look svelte. So she saw me over the course of 6 months for 3 treatment sessions. She was a really tiny woman, tiny legs, tiny hips, but it was just the upper fat.
That genetic thing again, where you carry the fat.
It is. It was genes, and she was really healthy. But we had 3 treatments in the upper back, and the results were just absolutely beautiful. And she sent me photos of her in the sari at a family wedding.
Rewarding. Some people
really nice.
Even cry with joy, don't they? And then you really feel that you've done something good for someone's self-esteem, because then that helps the whole family and etc.
Going back to some of my questions, I think I've kind of discussed how long do the results last for. You know, we said they're permanent. But we haven't discussed when I will see results. And this is important and relevant because patience is the name of the game with CoolSculpting, which is good in a sense that it's not having a huge sudden impact on your body, because it takes 12 weeks to see optimum results. And that's because it takes that long for the 27% of targeted fat cells to die and be removed from the lymphatics.
Just can't hurry that up, can you?
You can't.
Bodily function.
You can't hurry that up. You get a little bit of swelling, a little bit of inflammation after the treatment. That inflammation post-treatment is a good thing. inflammation is an indication that your white blood cells have congregated to that area, right? So we want the inflammation. It can last anywhere from a week to 2 to 3 weeks post-treatment. It's not significant enough that you carry on your daily lifestyle.
Is it
straight
uncomfortable
away.
then?
Overly, 99% of patients say no, it's not uncomfortable. It feels a bit, depending on the area that you've had treated, just feels a little bit tender maybe.
So if you're wussy, could you take an ibuprofen?
Paracetamol is my preferred medication, but
Why?
that's something we would discuss. Well, ibuprofen's anti-inflammatory.
Oh, of course.
And we want the inflammation.
Yeah.
But, this is a conversation as nurses we would discuss with our patients, because not everybody can take paracetamol depending on their other medicines and so on. But 99.9% of patients find it really comfortable.
Can diabetics have it?
Yes.
They can?
Yeah.
Wow.
I mean, there's up to 9 different areas on the body that we can treat. And unless someone has a significant peripheral neuropathy, let's say, where they're numb, they've got
they wouldn't be able to tell if something was digging in or something like that.
Exactly. And what would happen in that instance, it's not so much that the patient wouldn't be able to tell, because they don't need to tell, because as you very well know, because you chose the technology, it has freeze detect in it.
Yeah.
But their tissue may not respond appropriately to the paddle. It might not go
compromised or something.
It might be too compromised. So the circulation is relevant to the result.
Yeah. And that would tie up with some diabetics, wouldn't it?
It would. Yeah. But it's quite sick. That would be a significant, poorly managed diabetic. And we've never seen them in clinic, really.
What happens if people come in for consultation and they've got some sort of swelling condition like lymphedema or something unusually not necessarily fat? What happens then in the consultation?
Well, so lymphedema they might find, it depends on the severity of the lymphedema, and I would probably, it's a patient by patient case. So if they've got, let's say, significantly poor circulation in their lower limbs, and we're looking at treating CoolSculpting in the upper face.
Oh yeah.
I would most likely, and depending on their current medicines, but I would most likely think that that would be a safe treatment.
Yeah.
But if they have lymphedema, so circulatory lymphedema throughout the majority of the body, and they wanted to have their abdomen treated, I might rule out that it's not applicable, because I would be concerned that the risk would outweigh the benefit. And it would be more something like lymphatic drainage, and a massage and a hydrofacial would be more appropriate in that setting. Rheumatoid arthritis is another condition that I see in clinic.
Okay.
And it's interesting, it's not contraindicated. Patients can have CoolSculpting if they have rheumatoid arthritis, but often they may be on significant anti-inflammatory medicines.
Oh yeah.
So, and again, it's not a contraindication, but as a nurse, I make a clinical judgment depending on the patient. So sometimes they're on short-term anti-inflammatory medicine. So I say, finish the course, and then we will start the treatment a month after they finish the course to ensure they're going to get the best results. Because we want inflammation, because that inflammation is going to kill the fat cells.
Is there anything that can improve in your health by having CoolSculpting, that you've observed? I know that this would be anecdotally observed by you, but have you seen something where you think that was definitely worth it for this patient's health? I don't know, even mental health.
I think mental health is probably the most fundamental with CoolSculpting. So yes, mentally, because like I said earlier, the more you feel good about yourself externally, the more confidence you have internally.
Yeah.
And that's really, really relevant for women going through the menopause, for example, or for men, as men get into their 40s, 50s, 60s, their testosterone changes, doesn't it?
andropause.
Yes, and you know more about this than I do.
Well, I didn't even know it was a thing until I heard the word and thought, I can guess what that means, but let me look it up. Okay, so when males go into middle life, they don't have as much testosterone.
No.
Does that mean they could get more feminine, develop moobs?
They can. I mean, if they take care of themselves, if they sort of present with healthy lifestyles and everything, it's not an inevitability, whereas the menopause is an inevitability, but equally how we can go through the menopause can change depending on lifestyle choices. Yeah. For the most part, again, genetic predisposition always plays a factor. But men and women having something like CoolSculpting, it's really popular with men for the middle area, their waist area, as it is with women. Yeah. And it's because our hormones change in our middle.
I hadn't thought about that.
And that impacts our metabolism significantly.
They're like little drugs, these hormones, aren't they, really?
When they are
disappear,
drugs.
You're without them.
Yeah. So a bit of CoolSculpting can just encourage a bit of confidence, which can then inadvertently encourage more exercise, because someone might think, I feel more confident to go to Park Run with a group of people because I'm more confident in myself and I don't think I have to hide away and diet.
Or even the gym or something.
Exactly.
People sometimes delay joining a gym until they've lost weight. Poor things, because they're delaying something that could help. Yeah, it can be intimidating. What about moobs then? You know, man boobs.
Yeah.
Does CoolSculpting work for that?
It does, providing that it's fat and not a glandular. Yeah. You know, what's that called?
The breast gland. Oh, gynecomastia. Yeah.
So as long as it's not gynecomastia and it is in fact fat.
Well, that feels gristly, doesn't it? If the man was to feel it himself at home,
it does.
He would know it was like a disc.
Yeah.
And not like soft fat.
Exactly. Yeah. Whereas soft fat, how do you know it's CoolSculptable? Yeah. Well, you can pinch it. Yeah. Basically. Yeah. I get the question, why would I choose CoolSculpting over another non-invasive fat removal procedure? To date, CoolSculpting has the most clinical research-based papers supporting its efficacy and safety. It's FDA approved and CE marked. And it has built-in safety features like thermal detect. So it monitors your skin temperature as well as the temperature of the fat that it's trying to cool down to make sure that the skin doesn't get too cold and that the fat gets cold enough, which brings me back to patients don't have to worry too much about I can't feel anything or it's a bit numb, because the machine does everything.
Do patients feel like they need to trust the technology, or do you find yourself reminding them you ought to think about technology when you're choosing fat freezing?
It's variable. I'll have maybe 10% of patients want to know about clinical evidence and research and CE marked and FDA approved and the safety of the technology. But more commonly, people want to know, does it work? Does it hurt? How much is it going to cost? How many treatments do I have to have? Where can I have it? Am I suitable? As opposed to, is it safe? And it's interesting because we would love to hear, is it safe first
more
off?
Often. Yeah.
But I think patients need to trust us and know that we will take care of them.
I don't recall that we've spoken about seeing people from that have had other technology fat freezing, but I do remember right back in the beginning where someone came to us who'd had some sort of freeze burn and it had discoloured their skin. I don't know whether you remember the exact patient, poor thing, but obviously after being bitten, if you like, twice shy, she attended an open evening. Now I remember. I don't know whether you remember.
I do.
And she showed us, and of course we don't mention names, but this can happen, that if the technology is not that trustworthy.
And it can disfigure people. But more often, the most commonly seen thing I've observed with patients that have gone somewhere without CoolSculpting technology is a lack of result. Just a complete disappointment.
I see. And so they've wasted money.
And they've wasted money. Nothing's happened.
Yeah.
What I do see a lot is patients that have opted for liposuction. And again, I say it, we're not anti-surgery, we're pro-surgery, and if I consult someone and think they're more suitable for liposuction, I would refer them. However, liposuction, the technology is amazing now, but it can leave a ripple-like wave type thing in the fat. So more often than not, if I see a post-liposuction patient, I have to contour to sort of try and smooth out that area, because where they may look good with clothes on, if they put on their swim trunks or, you know, clothes off, they look odd, they look misshapen. I see. So, and typically these patients are quite lean and trim, so it's really unforgiving, a weird ripple in the fat. Yeah. So we have to sort of contour.
So that's where things like nurse experience can be very, very sought after by people.
I mean, at Qutis we've been offering CoolSculpting for over 6 years, and we've delivered over 7,000 cycles to date, I believe, give or take. And experience is really relevant. You learn things as you go along.
28 of those cycles were mine.
Yeah. You look fantastic.
No. But anyway, yeah.
And I think that kind of brings me to, why would you have CoolSculpting with Qutis? We're nurse-led. We have experience. We'll keep you safe, and we'll be honest with patients as well. Sometimes I say to patients, CoolSculpting isn't going to be your best option, but we can do this instead. Health, lifestyle, diet advice, and then it's nice to just pamper somebody for a day when they're with us.
It really does feel like you're in some sort of fantastic private hospital suite, and this is my own clinic. But of course, I have been used to delivering 1-hour treatments myself most of the time. A CoolSculpting treatment could be a couple of hours to 4 hours.
Oh, it can really vary. It can go from sort of 2-3 hours all the way up to 7 to 8 hours. It really depends. It's completely unique to the patient and their treatment plan, their goals, and what I think they can tolerate as well. CoolSculpting doesn't hurt. It's not painful. I get that question a lot. It's a short answer, which is no, but pain is subjective. Some people may find one area of the treatment more uncomfortable than somebody else, but for the majority of patients, and I really mean the majority, it's not painful. Weird would probably be the best description.
Yeah, it's sort of weird for a few minutes, and then it isn't. And you can work as well. You can bring your work, can't you, if you've got a long haul type treatment. Bring your laptop or watch something, listen to something.
And that's what most patients have a nap. I say to them, it's like an odd spa day. The lights are dimmed and you just we make you comfortable in the bed, bring you catered lunch. And everyone, it's funny because everyone that brings work with them, or I had a spate of patients that were doing dissertations, PhDs and masters, and they thought, oh, this will be a great time to read. They just slept the whole time.
They probably needed it.
Exactly. Exactly.
I suppose that's the Oxford clinics. We have more academics than we probably realise. But it's nice to think that academics are seeking us out, because in my experience, they often are the people who are more inquisitive about evidence.
Yes. Another question I get asked a lot is, does CoolSculpting help with cellulite? And it's interesting because CoolSculpting now firmly says yes, and I've seen this and I agree. But originally, going back 12 years, when they first introduced themselves to the UK market, they said it didn't help with cellulite, with the appearance of cellulite. However, now, because so many patients have been treated, I mean, last data I looked at, it was that over 11 million cycles have been delivered worldwide. That's how popular it is. It kind of goes back to, is it addictive? Yes, because it works. But you do see a reduction in the appearance of cellulite, in particular the thighs, which is where you most often see cellulite.
And you've seen it as well yourself.
I have, especially saddlebags and the backs of thighs. We can only treat certain areas of the thigh to make sure that we contour the body, in a complementary manner. But yes, it has a really nice impact on just reducing that appearance of cellulite. And skin tightening, of course. Under here, where we're removing fat, it does have a tightening, lifting impact at the same time, which is really nice.
And is that even across all age groups, or better with youngsters, not so good with older?
I would say it's even across all age groups, but it's relative to the pre-existing skin laxity. As you know, I mean, where are you going after this?
Well, I've got a non-surgical facelift to do with injections on someone who had her under chin fat CoolSculpted by our technician Helena.
Yes, that's right. And you're going to do some Profilo now, aren't you?
Yeah, so, in order to help tighten the skin. Yeah.
So you'll see a reduction in the fat pad, but certain patients, their skin laxity. So I say, you don't want to be ageist, do you? Because skin laxity can vary depending on individual.
True.
But the more mature the patient, typically the more likely they'll have a bit of skin laxity. So although they'll see some tightening from CoolSculpting, we support them further with a treatment plan of what you're going to deliver this afternoon, which would be Profilo and then a bit of jawline contouring.
It's really great that we can do this passing between specialties within our own clinic to have a fantastic end result. I bet there aren't that many places that do all three of those things.
No, it's a really nice service to offer our patients, and it's nice that they can come to one site, one clinic, and we can offer them everything to answer their needs.